In a hospital, we're often faced with getting medical needs assessed for our bodies, but what about our mental and spiritual health? When our overall health is down, our emotional and spiritual well-being may also need healing. Today, we're joined by Jawad Bayat, who will help us understand the role spiritual care plays in the overall health plan of patients to care for their body, mind, and spirit. Thank you so much, Jawad, for joining me today. I'd love to first start us off by hearing how you got into spiritual care as a career.
Well, it started when, I think it's partly important for me to say that I entered spiritual care, the idea of spiritual care, not easily. I am a son of refugees, and my parents sought refuge in America during the Soviet invasion of Afghanistan back in '81. So the understanding of spirituality and religion is the felt experience of it is very different in that context in Afghanistan, where being Muslim and like living within Islam is just understood. You can take it for granted some. So you come to America, and now they're a minority, and so now they give birth to me a few years later, and then I'm living and experiencing difference, and I'm seeing myself as a brown man, a brown kid, to be in that sense, Muslim, bilingual, all of that, but trying to understand like my space in the setting. But a lot of the ethos of spirituality and religion and Islam was still part of like the fabric of my culture and the background and the community, but they never really spoke to each other. So this bicultural understanding was rather isolated. And it was only until like for many other people when they go to college, right? Like I went to community college, so there was way more diversity. Grew up in Bergen County, and I went to the community college there, and so now I'm here struggling, trying to find my identity. And so a lot of my exposure to spirituality first began when I was trying to discover my own, related to just like, who am I? What am I? My place in my world, existential crises.
Yes.
Just, the simple stuff. And, lots of conversations, consultations. My parents were well worried about all that for me and what my trajectory looked like. And it was around that space, leveraging a lot of those relationships I had, that some of the same questions kept finding me. Like, why, through all of these changes, why am I struggling so much? Why am I, why do these issues keep finding me? And the same, let's just say, like gentle rhetoric of, find God, find peace, that kind of thing kept coming up. But it was at this time where my heart was a bit broken, and the light could enter, so to speak, happen. And I heard some words from in my father's restaurant, and there was I was just working that Saturday, and one of his employees, we were just sitting, he was talking to me in Farsi, and he had reminded me, I don't know how he knew, but he must have sensed that I was in distress somehow. And he said, if you choose God and if you choose things of that, you'll find peace in this world and peace in the hereafter, something to this effect that's related to our own Islamic tradition. And it dawned on me that I've given everything a shot except for this greater power, God. But greater power in that sense. And I started then engaging my rituals. So then I realized that, oh wait, spirituality is not something that's meant to be on a bookshelf. You're meant to live it. So that's where the spark of how spirituality got into my soul as something to be actually engaged. And then religion started to follow thereafter. And I started to realize, wow, I can actually engage it structurally in a way. Like I grew up with the rituals of the tradition, but it was only until I engaged spirituality that the religion came to life for me. And so then I was still in college. So that didn't change.
Wow, you're so young.
I was. Yeah, so I was still in college, and I was like, well, I can't go to seminary. I got to finish up my BA. And I chose psychology and special education as a background. But I had this set, and I learned about this Islamic chaplaincy program, which is the only accredited program at the time, and I had to keep it on the back burner. Finished I did some special education work, and it was my year of discernment, and I decided that it's time. So that when my entrance into the world of spiritual care happened through knowing that there was an actual opportunity for it through Islamic chaplaincy, and the program was called Islamic Chaplaincy Program, but it focused on interreligious relations and had a particularly Muslim and Christian relations, and with a focus on spiritual care.
Wow.
And that's the entrance into
It
it.
sounds like that was your trajectory
Yeah.
then. A lot of people have an existential crisis and like move to Europe, but
You're-
I'm so thankful
Yeah.
that
I
you
stayed in New Jersey, but my
you-
heart went to Europe.
you stayed the course. And I know that through your work at Trinity Health, you're able to help so many people. And so I'm thankful maybe that you started your spiritual work that early. So actually talking about your role at Trinity Health, I'd love to hear kind of what your vision is rather for the program, and just kind of what it means to you to care for this community.
So, even reflecting on just my little anecdotes, the whole idea is about change. And so with chaplains, spiritual care at Trinity Health Mid-Atlantic, so me as manager of Clinical Pastoral Education, I'm responsible for the clinical pastoral education, the spiritual care education for Trinity Health Mid-Atlantic. And part of my hope is to continue the regionalization of that, because that means that we have more chaplain presence in those locations, and that helps drive the quality of that. That's what education tends to do. So now, having said that, part of the hope is, like I said, I mentioned existential things, but you can understand that the meaning is involved in that, and so is change. Therefore, there's grief involved, and therefore there's loss involved. And what happens with spiritual care that's done at the hospital in these healthcare settings, there's probably nothing more significant in that person's life than the changes that they're undergoing at those times, whether it's an orthopedic surgery or a heart condition, end of life, even the birth of a child. All of these are changes, and chaplains are, especially through this professional education that we offer, are uniquely set up to help with these life transitions. We provide spiritual care, emotional care through these life transitions, helping them get a sense of grounding, help get a sense of who am I, where am I, all those things, those questions that come up. Sometimes they don't even know that it's there, but they're feeling it.
Right.
They're feeling it.
And you can help them maybe put into
Identify.
words and identify it. Exactly.
Yeah.
How do you, just kind of in the same thread, how do you view your role as being a part of this whole system? So with medical experts, doctors, advocates, how do you envision your team working together with,
I mean, that's the big
side of
question.
things? Yeah.
So we are professional. So at Trinity Health Mid-Atlantic, all of our settings, the chaplains, especially through the educational program, they receive professional education, and part of it leads towards, even if they were to seek it, especially like, for instance, like a residency program, what's called like board chaplain certification. But all of this is trying to highlight that we are part of the interdisciplinary team, the interprofessional team. So it's part of a cycle, a close the loop cycle of how we receive referrals, how we might do rounding, how we read chart notes. All of this is part of the experience. And so now, whether it's nurses, doctors, the medical residents, all of these, important people of the team are able to screen for us. And so part of the education is not just for students, but naturally when we're organically working with the interprofessional team, we want them to understand like what our role is so they can better leverage us. Because at Trinity Health, body, mind, and spirit is part of the whole focus. And it's part of what drew me to Trinity Health. I've worked at a number of secular locations prior to this. And one of the big draws for me was how we are inspired by these Catholic core values, but it's Catholic universal. So me as a Muslim is not removed from that experience. If anything, I feel even more at home here because, like I said, spirituality for me is integral to my health. From then till now, it is for my parents, but it is for so many. And this place, this location, this ministry, the healthcare, Trinity Health takes it seriously. That's what they can get when they receive treatment here.
When a patient is at Trinity, it's I feel like your program helps treat the whole person.
Yes.
Right, and
Yeah.
not just the reading a chart, and not that that's not important. So one thing you mentioned that I wanted to touch on is your Muslim faith, and I know Trinity is known, obviously for being a Catholic institution. Is there, in your role, I feel like you probably have the overarching view of the diversity of the program. Can you speak a little bit more to that?
I mean, I'm a testament to that. So the Trinity Health Mid-Atlantic has what's an accredited clinical pastoral education program, and that's and that's accredited by what's called the Association for Clinical Pastoral Education, and that's recognized by the Department of Education. And through this accreditation, it's robust, and we are blessed to have that. And part of the attention to this is that there are standards there, and it also lends towards attention to diversity and inclusion, naturally a part of it, because that's what lends towards better education. The more diverse perspectives we have, the more it yields insight and richness, and it's parallel to our care recipients, the diversity within them. So now you have. We then try, as best as we can, to have a diversity of perspectives in terms of lived experience, but also backgrounds in our program. So we've had Catholic priests, we've had lay Catholics, we've had Jews, we have had Muslims, we've had the whole spectrum of folks come through our programs, especially from a religious background. But again, that becomes a window towards spiritual care. So we're not teaching our students, so to speak, how to provide religious care, sacramental care. We're teaching them the art of spiritual care. And so if they're spending more time doing or like talking, they're not providing spiritual care. I'm talking right now, but I'm like educating. But like for them, as in the room, it's often a lot more about assessing and providing interventions that are way more subtle than we might typically imagine with this like a religious clergy role.
Right. Absolutely. Yeah. It's so much more, I imagine, nuanced. And like you said, it's not something that's readily like an aha moment, but maybe people feel it later on. Would you say that's kind of how do you mark, I don't want to use this word success, but like, how do you mark feeling fulfilled with your job and, seeing your colleagues do this work?
Yeah, absolutely. So I'll answer it two ways. One is related to, as a chaplain or spiritual care provider professionally, we do pay attention to outcomes. But like to your point, it's subtle. So did the care recipient, the patient, the family, the staff, colleagues, whomever, did they express, did a tear come down? Were they able to identify that feeling that they weren't able to before that? These nonverbals, things like that, those are the indications in the here and now for the chaplain to tell us, I think we're going in the right direction. So, we do these, that's how we get, in the educational program, we try to get the student to slow down, lower their anxiety, lower their cortisol level so they can become more creative and attentive to what's happening in the here and now moment. And you can see how useful that would be, for instance, in an end-of-life crisis, or there's a cardiac arrest and a family is really upset and all of that. You have the chaplain enter there, and so that presence is really important to not only help the chaplain, but also for them to be able to vibe off of that, so they can get more clear on what's happening for them, and especially in those very hard, just like life-changing moments. And then for me as an educator, part of like, why did I even become an educator is the other question. Like, I found for me when I was in the program and I was required to then take clinical pastoral education, I noticed that, oh wait, me learning about my own issues around unresolved grief, and as I resolved them, helped me provide better spiritual care.
Absolutely.
When I noticed that in my first unit, I then said, oh wait, and someone can teach this? I think I might want to do that.
Yeah.
That's how it happened. And so
it
now,
seems like the perfect trajectory for someone like you who's so introspective and like you said, unfortunately, I think we all deal with grief in our lives. It's just part of being human. But you took it and you're channeling it into helping others.
And like also grief is so normal. If I'm like you get a new car and you let go of the old car. I had a Toyota Prius and I bought a new one, but I had to let go of the old one. Now, is that a negative or a positive experience? I don't know. I got an upgrade, but I had memories associated with
Yes,
that
of
car, right? So
course.
there's a loss. So we're all living through loss and grief, whether it's donating a clothing item that you no longer use, but you had used for so long. And so obviously that might not be something that we're providing spiritual care to on a regular basis in the hospital setting, but all of life is life transitions, grief and loss. And so we provide spiritual care, particularly now taking that frame now inside of the hospital setting where change that are often like
Biggest
trajectory
changes,
life.
like you said.
Yeah.
Yeah.
Even bringing a child into the world, like that's a huge change, right? And then we have chaplains here to celebrate and also shepherd that experience too, should they want that.
Well, it's so funny. I'm expecting now, and I've talked to several friends about.
Congratulations.
Thank you, and I'm so excited. But like you said, it's just something like grieving the life that you had before you brought life into this world. It's not a bad thing to to say that was my old life, and now going through this huge life change. But
Absolutely.
like you said, that's a passage.
It is a passage. I mean,
Yeah.
we're thankful to have three young girls. When our first young girl was, when my wife was pregnant, I was thinking to myself, wait, I may not have time like I used to, and that was the first anticipatory loss I was
It's
engaging.
a loss, yeah.
Yeah.
It's the biggest gain, but it's yeah.
Yeah, and part of I think the thing with losses and naming them is to do them non-judgmentally. It is what it is, and the more then we start interpreting things like that, and create more judgments around it, that I think the felt experience of grieving becomes more complex. But I think loss itself is normal, and sometimes we try to explain it away and describe it. But now you have the chaplain in the room with the care recipient, the patient or their family, and often what we try to offer is non-judgmental presence and like interventions around what they're naming. How tough it must be, for instance. But like it's all that timing, and a lot of it is we're using our own self-awareness to sometimes engage the experience, but often is trying to name it. And often, when it comes to loss and grief, what I think tends to exacerbate it is judgment around it. Now, what we try to do is name it, identify it non-judgmentally, compassionately. And I think that's what lends towards the healing of it.
Yes, like you said, the path towards healing is like finding a name, but non-judgmentally. Well, as our episode comes to a close, I feel like we've touched on so much, and I could probably talk to you for a few more hours. But I would love to hear, before we do close our episode, do you have any final thoughts, like encouragement for maybe somebody who hasn't been seen by your healthcare system yet and who's never really worked with a chaplain before? Do you have anything you'd like to share as our closing thoughts?
Of course. Well, there's definitely ways to so all of Trinity Health Mid-Atlantic, the systems, we try to have chaplain presence there. And sometimes the big question is, yeah, I would like that, but I don't know how to access them. Well, nursing is probably, or whoever is your provider, will be able to be the best way to be able to access us. And oftentimes that's probably the quickest way to get to us. We do try to do rounding and try to make sometimes cold calls as possible, but sometimes, with so many patients, it's hard to know who wants. So
Absolutely.
the best way to get into it is to let your if you're looking for the chaplaincy support, the spiritual care support, let the staff know. The other thing is, if folks are interested in this education, we have a website, and so then it'll describe many of those dynamics that I was describing, like our different settings where we offer this, what clinical pastoral education is, and what's there in terms of the programs we have. So all of that's there. So if folks are looking for that particular care, let nursing know, let the doctors know, let your providers know, and they'll put the request and the referral and the consultation in. That'll help put you up to the top of the list. And then in terms of those who want this education, the website's there, and that'll be the quickest way to engage.
It usually is, yeah. And that's actually part of my closing of the episode, because you're right. It's like people could listen to us and then think, where do I take the next steps? And it is always going to be the website. So thank you so much to my guest, Jawad Bayat, for joining me today. I learned so much about the Chaplain Residency Program. And again, like Jawad and I said, please check out the website to learn more about the Chaplain Residency Program and how Trinity Health Mid-Atlantic can prioritize spiritual health for you. Thank you so much for joining us, and thank you.